Hello, everyone. We are saying good morning and good evening across the globe for this recording. Welcome to this video interview about the Editor's Choice article, which I'm very happy to present. Ravinder Sidhu from University of Queensland and Donata Rossi-Sackey from Mater Hospital, where Donata works at the Mater Refugee Health Unit. Their article, entitled Navigating the Politics and Ethics of Hospitality, Inclusive Practice with Forced Migrants, is, I'm very proud to say, the first Editor's Choice article of the first issue of volume 52 of British Journal of Social Work. Welcome both. It's so lovely to meet you.
Hello. Thanks for inviting us. We're thrilled to bits to have our article selected. So thank you.
It's my absolute pleasure. So we had a brief chat in preparation to start our recording about how you two met, and that led eventually, a few years later, to the development of this article. Do you want to say how you know each other and how you collaborate?
Mm-hmm. Absolutely. Do you want me to start, Ravinder?
Yes, please do.
I think I met Ravinder on the very first lecture in social work way back in the day. I was fresh out of high school. Ravinder had a bit more wisdom behind her. She'd already had one degree.
Maybe not.
We were very different life experiences at that point in time. Ravinder was incredibly eloquent, smart, wonderful, and I used to look at her and say, let's just get out of this tutorial and go for a drink. So I was the young, naive social work student who really did social work because I didn't necessarily want to change the world, but I did want to wear jeans and boots to work. So that was the essence of our initial meeting. But Ravinder, feel free to add.
I think that's a very generous introduction. Yes, that's how we met. And sometimes, you know, these relationships that come about, they're thrown together. We were thrown together into a tutorial. I think it was a Friday afternoon. How could you possibly put students into a tutorial on a Friday afternoon? But we were thrown into this Friday afternoon tutorial, thrown together, and we've maintained a critical friendship since then. I think it's one that's seen us through different professional practice. Donata and I both worked in the UK briefly. Wow. We shared a flat, like a lot of young Australians who, you know, as part of the new liberal state are invited into the UK. So it's been a long friendship. And I think certainly that relationship helped us to write this article.
Wonderful. And
do this research together.
And have you always worked with refugees, or have you worked across all different social work roles?
I have started, well, as Ravinder said, I really started the career in London, so working in child protection. And that lasted for a few years. And then coming back to Australia, actually went to work. I was always interested in the multicultural space. So went to work with international students, which was really another really interesting area with the universities and also with the Australian government. And then from there, was privileged enough to work with another great social work colleague to really start a new NGO that was a service for survivors of torture and trauma. And so from that moment, from about 1995 onwards, pretty much stuck to that refugee space, but kind of moved more into the health and primary health in particular, and the intersect between health and mental health, because clearly the two are very much go hand in hand, and really trying to unpack where the gaps were for people, because settlement doesn't happen for people without good health and good mental health.
Absolutely. Absolutely. And Ravinder, did you have a similar journey, and did you eventually find your way to this topic as well?
Yes, I think I had a slightly similar journey, but I wasn't quite as resilient as Donata. And at some point, I removed myself back into the ivory tower, so to speak. So I started, like Donata, with, you know, as every recent graduate, you grab a job that you can get. So I was working with children and families as well. And then from there, I started working as a student counselor in a private university of all places, and then something of a similar trajectory. But my interest in working with refugees, perhaps, may have started or may have been sparked off by my own family background, because, you know, some people will be aware that one of the biggest refugee global crises started in the Indian subcontinent with the partition of India. And so my extended family were in the Punjab, and the Punjab was partitioned. So, you know, I certainly grew up with these stories, and they weren't very pleasant, but they were also stories of people making new lives for themselves after displacement and showing tremendous resilience and raising their children. And then, of course, when Donata and I were both in the UK, that was around the time of the, you know, the end of Yugoslavia, if you like, and the trickling in of people from the former Yugoslav Republic. So we did, both of us, I think, have that kind of exposure, if you like, to, you know, forced migration, forced displacement.
Yeah, so our journey is probably to start intersecting at that point, because I'm from former Yugoslavia, and I also spent some time in UK as well around the same time, and it sparked my interest in working with refugees and working with displaced people from Bosnia within Croatia, and internal and from within Croatia as well, and then later on in UK as too. So there were multiple interests in this wonderful article that I wholeheartedly recommend. How did you start developing this particular article?
Shall I go first, Donna, on this one?
Yeah.
Well, I was part of a research team as a new PhD graduate on a project exploring schooling and young people from a refugee background. And the interest of the research team was essentially on what are schools doing with people from a refugee background. And so schools are remarkably interesting places. They are very, very busy places. And even if you are in a school of education, where we were, all the research team were located in an education department or a school of education within a university, it's quite difficult to negotiate access into a school. The school calendar is very busy. As you know, there's always something happening. So time and space in a school are heavily disciplined. And to actually interest teachers or school principals that research is worth doing about a group like former refugees is not always easy. And so I think in my conversations with Donata, she was team leader in the lead agency, the first agency set up in Brisbane to support people from a forced migration background. So, you know, she was pivotal, and her organization and her colleagues were pivotal in enabling us to gain access into these schools. So while we had ethical clearance and permission from the Department of Education, the main education bureaucracy, it was difficult to get in. So with their help, you know, we did gain access to principals, to teachers, to school nurses. And I rode on Donata's reputation, you know, and the manager of that, or director really of her agency then, said to me, when we have a really difficult and complicated issue, we send Donata in, because she manages to she just charms everybody. And so I thought, I'm onto a good thing here. So yes, you know, from a very pragmatic point of view, I was part of a research team, and the intention was always to write with Donata and her colleagues and to use the material to support their advocacy. But I don't know how it is in the UK, but certainly Australian universities are really quite competitive places. And sometimes, unfortunately, despite the best of intention, you know, research teams can fracture and fragment. And so it happens, people move and go off to different places. But yeah, we gained a lot from working, and, you know, further down the track decided to write together.
So do you want to start maybe explaining a little bit about the core of the article, although it kind of has several very important tracks, and how it relates to several principles and what they might mean briefly for social work practice, and how you cover concepts such as governmentality, boundary spanning, and hospitality as a kind of three key pillars, if I'm summarizing correctly, of the article, and how you approached the experiences people have.
Shall I go first, Donna? Would you like to go first? Because I've been talking too much, I think.
No, go for it. I'll chime in, don't worry.
So I'll say very briefly, so that we don't get ground in by the theory too much, that governmentality, as you know, is a form of understanding governance, and it probably somewhat different idea of power compared to the kind of social work education we received, which was very much about power concentrated in institutions, a kind of conflict notion of power, neo-Marxist idea of power. So governmentality is a different way of looking at power. It's more dispersed. It recognizes the contingency of circumstances, how things can be thrown together and how change can take place through these small encounters. So, just being able to have conversations with Donato, of course, alerts you to how on the smell of an oil rag, they managed to make things happen. And so governmentality, in a way, was a great way of theorizing about how power, how you can exercise power even in difficult circumstances. So that was one of the motivations. Derrida is a really key theorist around hospitality and the forced migration experience. So we were really interested in this idea of how is it possible, both of us have a migrant background in Australia, how is it possible that the soft multiculturalism that we experience, and I say liberal soft multiculturalism, with inverted commas there, how does that coexist with the kind of hard borders that, by the time we were doing this project, were very much in evidence. So these two theoretical perspectives certainly were really helpful in helping us to make sense around how we ought to be. This doesn't have to be the case. How can we step out of this kind of punitive hostility by both the state, but also a fair bit of popular hostility? Governments and elections have been won on the basis of this. So in that way, these theoretical frameworks were helpful. And boundary spanning, of course, came from speaking to Donata, because she did use this term, boundary spanning, and, navigating these institutional boundaries and finding spaces. So let me turn over to you now, Donata, because I think this is really important. It's a very, very salient practice issue. How do you, out of limited resources, make something of it?
I think, Ravinder, what you've kind of done for me, in a way, is provided me with some of that language and some of that theoretical framework that then kind of helps you make sense. And you might have a gut feeling or an intuition, or you might be doing things every day, but it really helps to have someone like Ravinder to reflect that back to you, and then to theorize it in a way that, I guess, can reach multiple audiences and in multiple different forums. But in terms of the why the paper came about for me and why I was excited when Ravinder proposed the idea, is that throughout all of this work that we're doing, we are very deliberate in the fact that we are very aware of all the limitations. We're always aware of funding limitations, political limitations, policy limitations. But what we do all the time is we challenge those in such a way that we can actually understand from the people we're working with, what is it that they want? So everything we've done to date has always been on the basis of actually trying to understand the relationships with community, with individuals within those communities, and trying to actually move what they're saying into a more public space. It's that private-public constant, dance that we're doing, but doing it with the communities. It's the old community development approach, nothing about me without you kind of, framework. but actually putting that within, I guess, the modern political, state that was Brisbane, Queensland, Australia, really trying to say, what if you're saying that we're delivering services for refugee, communities, but if those refugee services actually are not meeting the need, are actually not useful, are actually creating more damage, then there's no point of receiving that funding. There's no point doing those services. And so the fact that a lot of institutions continue to do what they think is right and not actually understand what is needed is a great travesty of the work that we do all the time. And it's much easier, I guess, to have an agenda and to go with that agenda than it is to modify that agenda. So our whole ethos all the way through has been about modifying usual practice. Nothing about what we do is not modifiable, and you modify it within the context of the communities you're serving, the politics that you're in, the policymakers that you're with, and that's where the boundary spanning comes in. You span from, working with community, understanding where the community leaders are coming from, the formal, informal leaders, nurturing those relationships, honouring that wisdom, bringing that wisdom to the table, still managing to have your relationship with your funders, still managing to have your relationship with government policymakers, still having your boards and everything else you're dealing with, and then moving that forward towards a new reality. And as Ravinder said, it's the small things. It doesn't necessarily have to be big things. A homework club that was started at the service that we're talking about, which was really out of a need for kids, that couldn't go home and do their homework and get assistance. That homework club is still going after almost 15, 20 years, that service has just celebrated 25 years. But the legacy of that homework club is still there. So it's the small things that can actually make a huge difference. And those kids are now kids that have gone on to university, and are now coming back to that organisation wanting to volunteer as tutors. So it's that kind of really embedding that.
Yeah. And you offered another example, which is really quite beautiful in clarifying why those small actions can make such a difference, with offering a dental service, which can be a big problem. So in one of the case studies, do you want to say a bit more about that project and why it was significant to cover?
That's a pretty amazing journey as well. So that also started when I was with that organisation, and it started because the University of Queensland offers obviously dentistry, and they invite us to do oral health presentations to try and raise awareness about torture and trauma and the impact in the consultation, etc. And again, as Ravinder says, relationships are so important. Became really good friends with the community dentistry lecturer. Were able to understand, that they were doing some great community work. But they also had a group of dental students from a Tzu Chi association. It's a Buddhist compassionate relief association who wanted to do good. At the same time that was happening, I was hearing from on the ground from our clients that they had terrible mouths. And in fact, there were a lot at that time, a lot of people from former Yugoslavia who had complex bridges in their mouths, and they had a lot of pain. They came to Australia. They were on a waiting list because at that time, nobody differentiated them. Nobody accepted the fact that some people hadn't actually had any oral dental care for a long time. So we had a need. The government wasn't going to budge on this because they didn't understand why they should. Had Compassionate Buddhist Association and the university on our side, and we brought everyone together. We brought the Queensland government, we brought the Tzu Chi, got the dentistry teachers and university people, and these wonderful human beings from the Tzu Chi Foundation decided that they could put a dental fair on. And in one weekend, they saw nearly 200 patients. And we negotiated to have the dental chairs from one of the government dental services made available on a weekend. And the backlog, like all these individuals that we're seeing, were then able to enter the oral health system because they'd already had their first appointment. But that drove a policy change. So in the end, what happened and what's happening right now is that through our Refugee Health Network Queensland, we have an oral health service. We have an oral health working group chaired by the chief dentist here that actually is looking at policies such as how do we look at asylum seekers who don't have access to oral health? How do we prioritize new arrivals? How do we triage people? How do we get people into the system and not let them wait until they're, you know, more settled? So from a small action, way back, giving a lecture at a dentistry oral health, to actually having policy change and having a working group that still is functioning and has the chief dentist chairing it. So I can see over, I mean, obviously I'm quite old and I've been around a long time, but to actually see that, you know, that journey, that continuity all the way through. And the Tsuchi are still delivering oral health services in a partnership with another NGO, and they have a dental chair, and they see homeless and people who are asylum seekers that don't have healthcare cards and don't have access. So, you know, it's an incredible kind of, and I'm so grateful to Ravinder that she gave me the opportunity through this paper to actually highlight some of that, because it is truly a beautiful story if you think about the commitment of all of these years of all of these individuals.
It's wonderful also to hear the story of how your relationship went from kind of sharing the journey of social work education and then in practice to really finding ways to collaborate and build bridges across academia and practice, and to think through where the merging points and what might emerge in that space where you allow yourself to collaborate that way. And I really hope that this serves as a motivation for many more similar partnerships to emerge. I don't know whether you want some time to say a bit more about the second case study that you highlighted, or would you prefer us to discuss some of the key kind of points that you offer in conclusion?
I think the second
G11
case,
or is that the G11?
the G11, yes. Yes, I think it's a wonderful example. So it's my favorite example. So please talk about it, Donata.
Absolutely.
So this again came about because we were seeing again gaps in service delivery and not really kind of reaching the communities and really trying to understand where the communities were at with issues. So the G11 actually started as for women, trying to understand what were the barriers and enablers for refugee background women to access primary care services. And especially at a time when primary care services can be, you know, lack of interpreters, lack of, you know, the funding for or gap fees associated with primary care. And so with a colleague, we were at that time lucky enough to get some philanthropic money. And this is again where I think thinking outside the box and actually getting flexible funding from an unknown source. We actually got it from a health insurance that decided that they would fund a community development project, which was again unheard of. And it was the first time the MATA ever got funding from this particular philanthropic group. And so with my colleague, this group of 4 became the group of 8, then became the group of 10, and eventually became the group of 11. And over the years, they've come and gone in numbers, but we've stuck with the G11. And Paula, who was the original kind of nurturer, the mother of this group, has published on the G11, but the G11 have actually become the ultimate boundary spanners. So they're natural leaders within their own communities. They come from different refugee background communities. They are regarded in their own community as trustworthy. So they hold a lot of trust, a lot of power from that. And what we were able to do with them was to actually nurture them and be able to give them a safe space. So they were employed through us. They were given some training. They were interested in research. So we developed the peer research methodology in partnership with other colleagues from another university. And we actually also wrote with them, and they did peer-led research, because we know that to reach vulnerable communities or more marginalized communities, it's much harder for us to go and ask questions. But in a peer, it's got limitations, but it certainly has huge advantages. So they are trained in peer research, and most recently, they were actually involved in the evaluation of our first refugee health policy and action plan. And they were actually the ones who collected the qualitative data that reflected whether the policy is working or not working. And we would never have reached those individuals. It was through this boundary spanning And through COVID, they have been phenomenal. It was through COVID that they first started to identify that we needed audio messages and video messages, because sending something only in writing to some communities where literacy is low, that's not going to work. They also said, don't put it on a website. We need to have it on WhatsApp or Facebook or our, in fact, there's a lovely story of our Iraqi background G11 member who managed to get all the COVID messaging through the hairdresser. There's a local hairdresser who is part of that WhatsApp group, and she tells a beautiful story of how it gets disseminated. And if she goes quiet for a while, it will be really, she'll be rung and said, what's going on? Is anything else coming out? So this is how that community relationship works, to the point that this, our Iraqi G11, the husband said to her, I just got a message, and it was the wife's message. So actually, that's how far the message spread. So I guess the G11 are a beautiful example of community development and community nurturing. And it's really about honouring that space and not just making it tokenistic. And the rewards that the community partnership brings to an organisation like the MARTA are huge. I mean, the MARTA, yes, has provided a really good, safe space with a lot of senior leadership to say this is important, it's embedded, but at the same time, the wonderful information, the knowledge, the wisdom it's brought back to the MARTA is priceless.
And you really wrap up well with the kind of 3 concluding points that you drew based on the case studies and looking and exploring the concepts across those 2 examples, which are so relevant. And now, particularly talking to you, I see all the time that this is not just something which emerged just for this article. There's a long-standing relationships across a range of community groups which just come, this is just a snapshot of them rather than something that is created as a one-off event, which seems also very, very important to have that prolonged, respectful, mutual relationships which are built through these projects. So do you want to say a bit more about kind of key lessons that you, based on these experiences, offer to social workers, and not necessarily just in this field?
Well, I think for me, just, extending what Donata has said, looking for these moments, these micro moments, if you like, where there are possibilities, and to grab hold of those possibilities, even despite knowing where they might end up, but actually to take the chance, to take the risk, and to try something different. And, she used the term to think outside of the box. I think that's incredibly important. I feel that sometimes if we are too guided by the theory and by analytical sort of concepts, we can hem ourselves into a box. Yeah. So I think that's important. I think it's the grassroots work, it's the relationship building. I think that's incredibly important, and using pragmatic means of getting around barriers rather than feeling that the barriers define us. I think that's certainly really, really important. I think the second thing that I got out of working on this paper is to have the opportunity to also take a big picture view as well as a micro, to look at the micro practices. And the big picture view, of course, is around how lacking, in a sense, the conventions are, the global conventions to support protection of people who are displaced, that the global conventions are framed, at a historical moment by particular power, politics, and there's still a lot of work to be done. So I think that was helpful for me, at least, to have the space to think through some of those big picture questions, if you like, while knowing that people through grassroots movements can do some fantastic things and restore hope once you move out of the policy, the bureaucracy, and so on, that people drive this change. I think that's been very important. Otherwise, the tendency to fall into despondency is great, at least for someone like me.
Also,
I think
wonderful to hear through what you've just described and reflected on, that and in the article you make an emphasis on respecting and being aware of everything people bring and their past experiences, yes, and how they shape it, and keeping in mind that you would not know, you would not be prepared to, particularly across a range of different cultures and communities which are represented across forced migrant communities that we interact with as social workers.
I think one of the key things for me, and I've learned this from another wonderful social worker who I work with, is that if you are going to work across different communities and communities who've experienced a lot of violence and displacement and are now living in this society, you have to expect that there will be times when they will be needing additional support, and that if you're providing a work environment, your work environment has to be conducive to that safety, because safety doesn't mean you just clock off and clock in and clock off. And so in order for this to create an opportunity or an experience of hope and safety, then as a manager or as a director of the unit, or as somebody who's in a management or leadership type role, then you've got to be really mindful that you need to modify your practice. You need to sometimes actually step back. Your expectations can't be always the ones that you think you need to have in order to manage a good unit, in order to be efficient, in order to meet KPIs, in order to do the things that you think need to happen, because that will undermine the hope and trust. And if you understand that that is equally important, then you'll modify your practice. And we kind of have written almost a whole policy on modifying practice. The Refugee Health and Wellbeing Policy and Action Plan talks about the need to modify your practice, and that means all of those things. And sometimes it also means pushing back against things that your managers, your boards, your people want, but doing it in such a way that actually yields hope and doesn't cause destruction. And the other thing for me, it's been that a lot of the time I'm cynical. I mean, Ravinder thinks I'm such an optimist, but I sit there sometimes and really worry, because in that middle management role, you often see the top end and you see the bottom end, and you're in that terrible squashed in the middle kind of zone where it's very easy to become quite cynical about the world. But what has always seen me through is that I need to take whatever I understand of what's happening at the big picture, use it to then be transparent and clear with the colleagues and my colleagues and the people who I'm working with, and making sure that I do exude some hope where there is a right to have hope. Never say never, never give up. Don't think you can't ask for something or you can't do something. We're forever pushing the boundaries in refugee health where we are, because if we had waited for somebody, as the Mater often used to say, the Sisters of Mercy used to run the Mater and used to say, ask and ask for forgiveness later. And I feel that that ethos can sometimes be helpful, because otherwise you get paralyzed by the things that are happening. We wouldn't be doing the things we're doing in the COVID response that we're doing with the multicultural communities right now. 2 years ago, nobody would have thought that we were in such a pandemic environment, and certainly nobody would have thought about multicultural communities. And yet now we've pushed the boundaries around that, and we said, no, you've got to change the way you message. You've got to co-design, you've got to translate, you've got to work with the chief health officers have to work with the communities. And that is kind of slowly but surely happening. So yeah, not giving up hope and trying to be flexible and mindful of our community's needs are probably really important across any health, education, everywhere.
And that sounds like a really good message in which to wrap up our discussion. But I think that you wanted to add something, Ravinder.
I think I just wanted to reiterate what Donata said, you know, about being flexible, because certainly in a university environment, sometimes the imperative to write, to publish, to get it out there is so great. So much relies on it that we forget about the relationships, about going back, about slowing down. And slowing down is incredibly important. Slowing down and listening carefully to what our colleagues that are in the field are saying to us, and you know, how we might support their work and what we might learn from them. I think that's very important.
And you really both emphasize beautifully this relationship between academia and practice, and with the communities with which we work, and enabling and supporting each other's agency, and to take meaningful risks for the betterment of the communities we work with, which is a wonderful message on which to wrap up our talk. Both, thank you so much for your time. It's been so joyous to talk to you both. I would encourage everyone to read your article, because it really is beautifully written and talks about important parts of our practice. So until the next time, thank you very much for being with us.
Thank you, Rhea.
Thank you.
Bye now.
Bye.
Bye.